keeping the focus on people. When the Northern Cheyenne tribe in Montana reached out to the CDC for help, the president of its tribal council was in the hospital with COVID-19. The day that she was discharged, she drove herself home and joined a 3-hour call with the CDC and other tribal leaders to develop a response plan. The CDC's Kellie White was a participant on that call, and as she listened to the commitment of the tribe's president, she decided to do whatever she could to help. Kellie recalls, "If she's willing to do this work being so sick, I can certainly step outside of my own comfort zone." Kellie is a quality assurance specialist who focuses on preparing laboratories to test for emerging diseases. Her team serves as the first line of defense to test environmental or biologic samples and distribute important information and materials to laboratories all across the country. Kellie understands the importance of timely and coordinated response to public health concerns. When Kellie was first asked to work on the response in June of 2020, she had no doubt about her desire to take on that challenge. Although a little bit nervous about her lack of knowledge about tribal culture, she took a step that she now views as a journey of learning that extended far beyond my expectations, Kellie says. Since then, Kellie has worked with 23 tribes across the country. In her recent assignment with the Northern Cheyenne, she worked from Atlanta as a link between CDC responders in the field and its leaders still at headquarters. She also met regularly with CDC and other partner organizations. The needs of the tribe were extensive, and meeting them required thoughtful planning and coordination. CDC's assistance involved a team of 12 people who worked with several partners. This includes the state of Montana, their National Guard, the Indian Health Service, the Federal Emergency Management Agency, or FEMA, and the U.S. Department of Health and Human Services. With so many players from various agencies, Kellie knew she needed a cohesive and balanced approach. Kellie says, "I learned a long time ago that to help unlock discussions, it's better to ask a question than to start by sharing your opinion." That approach was instrumental in keeping the response running smoothly, while she communicated questions, goals, and concerns to keep the appropriate people and coordinated plans for services. With the partner organizations, the team helped to develop and strengthen a variety of services, such as COVID-19 testing, quarantining methods, contact tracing, and outreach and communication programs for the community. Kellie identified needs for more CDC support and arranged weekly calls with the entire team for updates and planning. Kellie says, "On the first couple of phone calls, I heard despair and loss of hope. But then eventually, we heard hope and optimism and saw the resilience firsthand. We were able to plant the seeds for momentum, and they picked up the ball and took it for themselves. Kellie was impressed with how seamlessly the plans had rolled out. She attributes the success in part to the tribal members on the team, including 2 from CDC and a Montana tribal member who worked with the state. Kellie says they could anticipate where some of the challenges might exist and spoke in a way that made the whole team want to listen. They helped the team understand the significance of tribal ceremonies as well as other important cultural events. Sometimes that meant going back to the drawing board and limiting the number of people who could attend or make other adjustments to keep people safe and not inhibit these important traditions. Adapting is how Kellie handles much of her life these days. With 2 young children at home, while she and her husband worked remotely for much of this past year, she understands the need of flexibility. Kellie says, "You may not get to determine the order of your activities for the day, and your schedule may not always be your own. But you feel like you're actually making a difference during this pandemic." Kellie describes her deployment as a front row seat to see the CDC's work happening in action. She watched a transformation among the Northern Cheyenne in Montana that she feels is a very important opportunity to better understand the CDC's agency impact. Kellie says that tribal members who initially reach out to the CDC with despair and fear in their voices now have gratitude, confidence, and hope. Sometimes it's easy to lose sight of the people attached to your work. These deployments have reminded me of the reason that I got into the public health workspace in the first place.